Hello guys, in pediatrics they can ask you cerebral malaria as an important topic. So what is cerebral malaria? It is a severe complication of malaria. And why is malaria caused? By a parasite. What parasite? Plasmodium vivax or Plasmodium falciparum. When this falciparum will be causing all these kind of severe complications. High concentrations of this Plasmodium falciparum will be there in the microvasculator. It will infect what? The erythrocytes. So let's look at this cerebral malaria image here. So this is uncomplicated malaria. The brain, you can see all these sulcus gyri, right? That's what they call them. They look fine. But look at cerebral malaria. How the brain is looking so washed out, like blurred out image, right? So there is severe swelling and it could be fatal. Okay. So this is what exactly is happening inside the blood vessel. You can see here, this is the resting endothelium. There are some receptors here, but in this endothelium, you can see there is a lot of activity going on here. Some EPCR binding parasites. Okay, so basically a lot of issues here. So basically blood vessel, right? Inside the blood vessel there is problem. Inside the brain there is swelling. Fatal complication of malaria this is. Okay. So how will the patient be? They will have acute febrile encephalopathy. What will be the presentation? Acute febrile, they'll have fever. Remember, they'll have fever, and encephalopathy means some kind of central nervous system effect, right? So what will be there in these people? Convulsion, guys, and coma. Okay, convulsions, coma. See, there is a baby here or there is a child here. What does it have? What does it have, people? It has encephalopathy, convulsions, coma. Okay, then this child can have hepatosplenomegaly, seizures. Okay, hepatosplenomegaly with seizures it can have. Okay, please write all these words, very important in exam. They have convulsion, they have coma, they have fever, acute fever, there is hepatosplenomegaly, they have seizures. Hepatosplenomegaly means what? It's an enlarged liver. So they can have headache, mental disturbance, neurologic signs, convulsions, delirium and coma. So you have to write all these as clinical features. Do not forget. Then there is this coma which cannot be explained. Okay. And what else? These children may have vomiting, cough, diarrhea, respiration can be rapid, jaundice because their liver may have problem. They could be in hypotension, shock-like state. Okay. So are you able to see it? Is the color okay for you people? Weird color. Now, yeah, now it's better. So shock-like state, vomiting, cough, diarrhea, respiration is rapid. Okay, jaundice, etc. Now let's move on. Guys, we are finding a lot of information from multiple textbooks. Look at this. There can be diffuse symmetric encephalopathy. You can see here the situation is diffuse, right? The entire brain is affected. The eyes may be divergent. The brainstem reflexes may be lost. Abdominal reflexes may be absent or invariably absent. Decerebrate or decorticate posture will be present. Retinal hemorrhage, DIC can be there. Convulsions will be generalized and repeated. And some of these people, even though they survive all this, finally they may land up having a neurological deficit, which doesn't sound good. So that is why they ask you cerebral malaria in the exam looks like. First of all, malaria is very common. And secondly, it is affecting the children very badly if it is affecting the brain. Alright. Now look at this. They have shown how the brain becomes. See, it has all the sulci gyri and all, and look at how it has become diffuse encephalopathy. And here they have shown how the vasculature is affected, right? Okay. So this is all because of a mosquito bite. Can you imagine that? A mosquito which carries Plasmodium falciparum, the protozoa, right? And this mosquito is which mosquito? Come on, think. It is female Anopheles mosquito, because female only will bite deeper. Yeah. Now, how will you treat? Before that, one important thing I wanted to tell you. Okay, look at this. If there is a fever in a child, acute onset fever, and there is coma of uncertain origin, and there is no evidence of meningitis, you should always think of it as cerebral malaria and start the treatment. So this is the clue for you for treatment. Let's put it here before the treatment slide. If there is a child that is coming to you which has acute onset fever, coma of uncertain origin, there is no evidence of meningitis, then you should treat as cerebral malaria in endemic area. Endemic means most places in India, right, and a lot of other world where there is malaria. Okay, why is this? Because of Plasmodium falciparum. So they are telling very specifically how to treat. Okay, as a pediatric, you should nurse in lateral position, so the child is put into one side, left or right kind of a thing. You have to turn it every 2 hours. You have to give nasogastric aspiration so that it doesn't aspirate, is it? Maintain the airway, irrigate and patch the eyes. They're protecting the eyes, guys. It can be hemorrhage, they told somewhere, right? If convulsions occur, then what you should do, you should exclude hypoglycemia. Is this child having hypoglycemia? That is why it is having convulsions. You should check, is it having hyperthermia? It has fever, right? So you should rule out all this. Manage seizures with diazepam. Give diazepam for the fever. Very good. Midazolam, lorazepam. Standard treatment for what? Standard treatment for what, guys? Diazepam, lorazepam, midazolam. Yes, for convulsions. Very good. Now let's move on. Consider CT scan. Yes, and if you do that CT, you will get that nice image, right, of the brain. You can look for intracerebral bleed, cerebral edema, herniation, etc. Especially if there is loss of consciousness or the child's condition is deteriorating, you can consider a CT scan. But otherwise, you can understand that we have already started the treatment as cerebral malaria. What is the treatment for malaria exactly, guys? See, malaria, guys, is treated as uncomplicated versus complicated, right? So you can look at this. So if it is Vivax, you'll just give chloroquine with primaquine. If it is chloroquine sensitive falciparum, again same thing, chloroquine with primaquine, right? Then if it is resistant falciparum, you can give artesunate, right? That is called as some ACT therapy, artemisinin based combination therapy, remember, where you will give artesunate, mefloquine, right? Artemether, lumefantrine, so many combinations are there. Okay, but if it is complicated, what will you give? These are the complications. So now let us see how to treat severe or complicated falciparum malaria. This is from your pharmacology textbook, by the way. Look at this. You will give artesunate, artemether. That's it. Artesunate, artemether. And in the pediatric one, they have mentioned only artemether. So we'll go with artemether. Okay. So just write some 3 names. Okay. What and all will you write? Quinine. So just write chloroquine. Then write primaquine to avoid those hypnozoids and relapse. And then artemisinin based combination therapy. Okay, artemether, mefloquine also you can write here. Artemether, mefloquine, right? All this you can talk about. Okay, this much is enough for us. Now, what are the supportive care that you will give for a child who has cerebral malaria? Supportive care is from here. So you will nurse the child in lateral position. Supportive. You will nurse the child in lateral position. You will turn it every 2 hours. You will keep aspirating continuous nasogastrial aspiration so that it doesn't choke. I'm thinking. Maintain the airway, irrigate, then patch the eyes. They're very concerned about the eyes here. Patch the eyes, okay. And if the convulsions occur, what will you give? Everybody will say diazepam, midazolam, lorazepam. Very good. And then if the condition of the child deteriorates, you can do a CT scan for intracerebral bleed, for cerebral edema, herniation, etc. Then what else will you do? You will always nurse with the head propped up so that the intracranial pressure will at least decrease a little, right? And then you will check for hypoglycemia, etc. Use of mannitol is controversial. Steroids also do not have a role. Okay. So this is all about cerebral malaria. Guys, do you know how to check whether it is malaria? That part we didn't tell you, right? So in investigation, so look at this. You will have this peripheral smear you can do, and you can see these gematocytes, right? And then also you can do this rapid malaria antigen. You can check by rapid ICT. Okay, we'll just add that here for the treatment. See, you will anyway suspect it as cerebral malaria. Okay, and you can start the anti-malarial drugs. Then you can check. You can check peripheral smear. You can do peripheral blood smear, or you can do rapid test. Okay, for malaria. All that you can do to confirm the diagnosis. Okay. That's it, guys. In this video we have looked at cerebral malaria. Just look at how it is, you know, this image. I'm thinking this is a CT, right? Because the bone is white and you can see the inner cross section kind of a thing. So you can see how the brain is kind of looking blurred, washed out, right? So this is cerebral malaria. That's it for now, guys. Hope you learned something. Bye bye.